right, this is the next section of anatomy and physiology applied to dance. So when we do a plie, we'll start with plie. We're gonna demi-plie down, right? Now, we've already talked about the core engagement, keeping the spine in neutral, all of that stuff. Now, plie, let's just kind of break this down and I'll probably blow your mind. You're gonna plie. This is a eccentric, that's a lengthening of your muscle coming down, and then a concentric coming up. Now, where should you be feeling this at? I've had teachers who I've seen in class say, flex your hamstrings. That's the back of your knee because it bends the knee, right? And then you're going to squeeze in your buttocks to come up. But then you see that that thrusts the hips forward. We learned earlier that the glute max will extend the hip. We're not trying to get into hip extension when we're doing a plie. What we're trying to do is hold neutral, right? So when you go down, it's actually not that you're thinking of the hamstrings flexing the knee. That would create a very jerky and rigid movement. You're eccentrically lengthening through the quadriceps. So you're putting the quadriceps on a stretch with that eccentric lowering, right? Are your hamstrings going to be active? They isometrically will. They will stabilize you here, but they're not concentrically trying to shorten quickly. So when you're instructing your students with plie, lengthening through the front of the thighs, that's your down phase. When you come up, it is not about squeezing the glutes. It's actually going to be about squeezing the inner thigh muscles. And if they squeeze those inner thigh muscles, the adductors that bring the legs together, that automatically will kick in those deep rotators. Deep rotators are going to be under here. They're deep, right? We don't want them to hip thrust. We want them to use their adductor muscles that squeeze together and their deep rotators. If you have them stand in second position and place their hands underneath the buttocks, get up and do this yourself right now and find the top of your hip bone, okay? Now, exhale. Bring your core into neutral by activating your transverse abdominis, okay? Now, I want you to think about squeezing the inner thighs and the muscles underneath your glute max, okay? Look at that. That's your deep rotators, okay? Come up to a releve second press, and you should be really feeling it through here, a little under here, and a royal lot through there. So all in all, that is what's happening with the plie, right? Some other muscles that I want you to think of making sure your students are not turning on and that you are also helping them shut off is the tibialis anterior, because we know that the tibialis anterior flexes, dorsiflexes back. It will bring your toes back towards your nose. And if you look at a plie, your foot is technically going into that position. However, it is going into that position passively because of what's happening at the knee joint. It is not going into that position actively. So that student shouldn't be trying to contract the front of their shin to go deeper in their plie, because it actually will stop them from going deeper. So just try it for yourself. Try to contract the front of your shins and pull your toes up. And guess what? You're not going to be able to go as far in your demi-plie. If you relax all of that and you just think about that controlled descent, then you're going to be able to go further in your demi-plie and get your students to go further as well. Tendu. So if we're doing a tendu to the front, we are feeling that adduction of the adductor muscles, right? And we're also feeling a hip flexor. So hip flexion is happening here, but it's more an open chain hip flexion. So we're not weight bearing through it. We're just gliding the foot front and back in. You're also using that lower leg plantar flexion of the gastrocnemius and soleus. You will use the gastrocnemius and soleus to the side and also to the back as well. To the side, you're using abduction and external rotation at that deep rotator. Every time you close, you should be thinking of the adductors. When we close tendu back, this is a hard one. Now, we obviously are rolling down through the foot intrinsics, and we're using the adductors as well as the flexors to close with control. Now, this is one of those movements, just like demi-plie, where you're thinking, okay, this is actually the lengthening of the extensors and the eccentric extensors controlling that coming in, rather than you thinking, flex the hip with a lot of force, right? So sartorius, adduction, transverse abdominis, diaphragm with helping you breathe to exhale, iliopsoas, flexing the hip. These have to come first. If they don't, you end up with the turned in développé. You end up with the student who's really gripping in their hips, right? They're doing that big exhale. Are they gonna feel it in their quads? Of course they are, because they're on, right? You have to have your quads on in order to straighten your knee. That just has to happen. But the important thing is that the power in the initiation comes from here, and the breathing technique is appropriately placed. And if you think about those actions, you look at the pictures, they also are going to apply to grand battements or anything that you're doing in the center.